All right, so we are going to look at identification notes on helminth adult and larva today. So for my notebook, I've got ID notes, adult helminth. We're going to put the name of the helminth on the left-hand side and then characteristics of the species on the right, as well as a drawing. Hopefully, we can draw at least the tapering of the body, oral cavity, or the caudal end of it. So definitely that drawing is going to help you identify with the shape of the different helminths. And then as always, name, date, and session in the top right hand side of your notes. So we've got our Quizlet right there. There's also some different websites. We've got Merck Veterinary Manual. They're an amazing resource when we're looking at different diseases and pathogens or disease causing organisms. So there's some more information on flukes, roundworms, and then also some other worms up there too. So helminths, if you haven't figured out yet, helminths are worms. So we're going to start with helminth. And so the scientific name is Metazoa. And these are a subkingdom of worms that are both parasitic and non parasitic. So they might be parasites, they might not, just kind of all depends on where they live. So this is the subkingdom Metazoa. And then we have two phylums or big categories. You have nematodes and you have Platyhelminthes. So that's where we get the helminths from. Okay. And then we have cestodes and trematodes in the Platyhelminthes, and then genuses of nematodes are up here. And then we have tapeworms, liver flukes, and root leaf shaped worms down there, which is that genus. So we are going to be talking about helminths, which is boop, worms. All right. So first class we're going to talk about is our nematodes. Your nematodes is the phylum of roundworms. So roundworms, we have Ascaris, which is our roundworm. We have Tricharis or Tricharis, which are whipworms. Ancylostoma, which are hookworms. Enterolos or enteroblus, which are pinworms, and then we have strongyloids. So those are the types or the phylums of the roundworms that we're going to be talking about. So these worms will have a rounded body. Then we've got Platyhelminthes. So Platyhelminthes is the phylum of flatworms, which include both cestoids and trematoids or trematodes. All right, so first we have tapeworms. Tapeworms are cestodes. So those are a type of cestodes. So tapeworms are cestoids. Then we have trematodes. Your trematodes are your flatworms and your flukes. Right. So trematodes are flatworms and flukes. So we're first going to talk about that first phylum, which we're going to go into our flea tapeworms. So these are nematodes. So flea tapeworms is in the genus Diploidium, and their appearance is flat, composed of multiple long, narrow segments. Route of transmission. So, how do the animals actually get an infection with this organism? Is that they are ingested from the adult fleas and other host containing larvae. So, if your animal is infested with fleas, they eat their fleas when they're grooming themselves. And so then they're able to carry those eggs and larvae inside of them. Symptoms are going to be irritation around the anus or the rectum when the segments are passed, and often it's asymptomatic. So, asymptomatic, we learned from a packet, is not showing symptoms. Effect on our host, they are going to attach to the small intestinal wall of the host and consume the nutrients from the food the animal is eating. So, your animal may lose weight because the the parasite is actually eating the nutrition. So your nutrition is not able to be absorbed into the body. So that is a flea tapeworm. So think of flea tapeworm, I get them from ingesting the fleas. Here is a flea tapeworm. So we are segmented and kind of flat in appearance. And then a flea tapeworm segment looks like a grain of rice. So we're going to remember flea tapeworms, they're going to look as though they are rice kernels. Okay. Then we have our heartworm adults. So heartworms, we know they're worms that live in the heart. Parents, they're very long. They're thin, white cylindrical worms. Route of transmission, your animals get heartworm from being bit by an infected mosquito. So symptoms are potentially death in cats, and it may just be all of a sudden your cat just unfortunately passes away. Persistent cough in animals, asthma like attacks, vomiting, lack of appetite, weight loss, lung disease, heart failure, effect on the host, they are feeding off your nutrients in the blood. So the heartworm, once it's infested, it travels through the circulatory system as a larva and an adult. It lives in the your segments of the heart, and so it's eating the blood. All right. So what happens with cats is that those valves and whatnot are so small that the worms can then trap in between those valves, preventing them from closing, which then creates backup in the heart and is not a good thing. Okay. So that's what leads to death. So for cats to get heartworm, it's very, very serious. We're starting to see more heartworm now because we are getting animals into the northern states from the southern states. So we're taking them from kill shelters and bringing them up here. But the mosquitoes down south have a more higher frequency of having heartworm than ours up here do because one, the species of mosquitoes, but then also two, we have that winter which kills off our mosquitoes. So then we don't have to worry as much about that heartworm transmission during those times. It's still something that's possible. So it's great to have, and you should have your animal then on heartworm preventative year round to make sure that they don't get heartworm. And it's very, very expensive to treat if you're fortunate enough to be able to treat it. So heartworm, the adults, they just looks like stringy pasta, almost angel hair pasta, if you will. That is what the larva look like, and we call heartworm larva microfilera. They are little tiny worms, and you'll see them in blood smears if you're lucky. So that is just a little tiny larva right there, and it's called a microfilera. Next, we have a hookworm adult. Our hookworm adults are small white teeth-like structures in the mouth. So it is kind of interesting. So if you think about hookworm, they're going to hook in with their teeth. The route of transmission, again, I'm going to consume contaminated soil or even feces. So if animals defecate on grass, that defecation is still there. So my animal may be grazing, not necessarily eating the fecal matter, but the fecal matter hit on the grass. So it can be contaminated. In utero means that it can pass through the placental lining. Okay, so in utero is the development of the fetus, mother's milk. So when the animal is consuming after it's born, if it's consuming its mother's milk, there is a chance that it can be contaminated that way as well. So some symptoms is going to be anemia. So low blood cell count, red blood cell count, diarrhea, lethargy, weight loss, poor appetite, dark and tarry stool. Effects is that they attach to the small intestinal wall and they feed off the blood vessels. So that's why I'm seeing the anemia, and that's why I'm seeing that weight loss as well and the lethargy because I don't have as much energy because my blood isn't getting all the nutrients that it needs to. And again, these are hookworms. And so here we have the hookworm. You can kind of see that hook piece on the top of the female, and then that male. So a buccal capsule, that's that mouth capsule or where it attaches. Okay. Next, we have horse strongyles. So horse strongyles affect equines. So they can be up to 5 centimeters long, about the size of a matchstick, anterior and blunt with wide buccal openings. So again, a buccal opening is the mouth. There are various species based on that buccal cavity. So we are able to identify them based off of their mouth. The route of transmission is lactogenic, again, from the mother's milk. Oral, so ingesting the contaminated materials. This can be soil, this can be water. And we have percutaneous. So percutaneous is through any opening skin. Okay. So you might have a cut on your skin, or an animal may, without even knowing it. Maybe a mosquito bit. So if there's a mosquito bite, that's open skin. So, or an open wound. So then if you're passing through contaminated area, then the strongyles can get through that. So symptoms are going to be intestinal ulcers, anemia, colic, which for horses is like an upset stomach. It's way more than that, but to be a horse and have an upset stomach is could be fatal. Dehydration, emaciation, so dramatic weight loss, weakness, and aneurysms. So the effect on the host, they are feeding off of the blood in the small and the large intestinal walls, and some will even migrate to the blood vessels in the liver or the pancreas. So this is why it can be so detrimental to your animals because it can get into the liver, which processes your toxins and things. So that is your horse strung isles. And your adult here is pretty wide buccal opening, and then it tapers off. And these can be about the size of a matchstick. Next, we have our roundworm adult. So roundworms are white or light brown and resemble spaghetti noodles. So think of thick pasta. The route of transmission again is your mother's milk or in utero, and the consumption of contaminated rodents. So rodents often have these. So symptoms are going to be coughing, bowel obstruction, weight loss, distended or swelling abdomen, and diarrhea. Effect on the host: they consume nutrients from food animal is eating, and they can also move into the lungs. So this is one of those again. I'm going to see weight loss and that diarrhea because I'm not able to absorb nutrients and I have worms in my intestinal tract, which then affects everything related to my body. And those are roundworm adults. In here we have, they look like spaghetti. All right, so very round spaghetti shapes. Next, we have Tinea tapeworms. So we had the flea tapeworms earlier. Now we have the Tinea. So these are flat and composed of multiple thin, wide segments. So the segments are wider than they are long. Consumption, again, is going to be our transmission is the consumption of rodents and or rabbits. Symptoms: irritation around the rectum again when the segments are passed, often asymptomatic. So you may see your animal scooting around a lot, and then you might see little white specks from the rectum. Often on the host, they attach to the small intestinal wall of the host and consume again those nutrients from the food so that the animal is eating. So Tinea tapeworms, you can see are very short but long, right? So they're not very deep, but they're very long, very flat. So these is your segment right there. So these are nice, short, or very wide and flat, versus the flea tapeworm, which looks like rice kernels. All right. So the next is a whipworm. If I think about the word whipworm, this whipworm actually is going to look as though it is a whip. So they are thin and elongated anterior front end with the posterior that is wide and more blunt, that should say. Route of transmission: consumption of infested matter such as water, food, feces, soil, or carcasses. Symptoms: watery, bloody diarrhea and weight loss, dehydration, and anemia. So the effect on the host: they cause severe irritation to the lining of the large intestine. So here's our whipworm. Again, here is your mouth is on that edge of the whip. And so it's very, very thin here, but then it thickens up at that tail end. Last, we have a liver fluke. So liver flukes are a flatworm. They have a symmetrical flat body. They route of transmission is ingestion of the tissue of infected with eggs. Symptoms can be asymptomatic depending on the species of the animal infected. They may cause varying degrees of liver dysfunction from jaundice. So jaundice is the yellowing of your skin and the eyes, fever, change in appetite, stool alteration, effect on the host. So what happens with these flatworms is that they block the liver duct, which then affects the your bile, right? Which is why it's affecting your stomach, and then they start to break down the liver tissue. So an animal is not is able to process those toxins. So that is a liver fluke. And here we have a liver fluke. So that is the buccal opening right here, and then it is symmetric and flat. So that is your liver fluke flatworm.